hours. 3 hours of questions and answers. Uh, First, we'll go over strategies. Then we'll practice some questions. For those that are testing soon, if you are in the course, please email me today. What I'll do is I'll release the diagnostic test 3, which won't be a test format because I put it answers the rationales, but it's important that at least you go through the rationales. But I'm only releasing this to those that are testing very soon. Okay, so yes, please email me. I have your name. You have to email me. Okay, so what is my email? Is PMHNP at npexamcoach.com. I told you guys that I was not going to be able to do lecture this week as I'm moving back to the US this weekend, right? But I couldn't resist. I just couldn't. After a long fight with my wife, I guess I won, but really I lost because every time I won, every time you have a fight, you win anything, you actually lose, right? That's how it usually goes. So she's pretty upset, but I just couldn't resist because I know some of you guys are testing, specifically one person that I will not mention the name that didn't do well the first time. And I really want to give it one last push and make sure that that person passes the test. You don't have to say who you are, uh, you know. So, yeah, I just couldn't resist. I'm sorry. So that being said, let's get started with this event. So again, uh, Tanya, if you don't mind, well, what is your question, my dear? If you have a question, please mute yourself and ask. All right, I guess you don't have a question. That's fine too. All right, so again, just want to repeat this one more time. We're going to go over strategies first, and then we'll answer 50 questions. Just about 50, 40 questions. And those that are testing, I will release this to you early so you can practice today, tomorrow. Not today. Today is going to be a long day. You should sleep. You need to convert your short-term memory to your long-term memory by sleeping, right? Hippocampus, part of your hippocampus. Basically, sleep is super important. Don't don't do what I did many times and it didn't play out well for me. So don't do it, please. I know, resist the urge to one extra and, starting one extra, whatever you need to. And you have what it takes. I promise you. I promise you that I ask you to do a lot of things, right? It's crash course review, module, question bank, diagnostic task. We are in a daily communications on a WhatsApp app. So there is a lot of things going on. But at the end, it will be sweet. Okay, at the end, it will be super sweet when you achieve the board results that you need, that you want. It- like, I just can't even begin to imagine of a better feeling than passing the board, right? If you are like most of us, you've been a nurse for a long time, you did your BSN, and then one day you said, hey, I want to be a psychiatric nurse practitioner. And you went to school, you did your master's, you did your doctor's degree, and you graduated. And this is the last push, you know, that's the last thing you have until you start basically a new career. It's entirely different than anything else you have ever done, right? You are driving the train, you are placing orders, and you are using your own rationales. And that is one of the reasons why my course is a little bit different than others, because passing the board is just the beginning. What you do after is very important, right? So hopefully the lessons learned here will serve you more than just passing the board. Okay, so now let's get started with our crash course review, which is just strategies, right? We're going to cover a few things. Some of them are very simple, or so they seem very simple, but then are you able to get this stuff, the knowledge that you learned here, and apply into a question? So this is why we're doing a little bit of recap on their strategies, and then let's try to apply it. Now, remember, your knowledge is what's going to get you through the test. Strategies are reserved for the questions that you do not know how to answer. Okay? And as simple as that, do not add any information that's not added to the question, right? Avoid making assumptions. That's huge. That's huge. All right. Adding extra details not mentioned in the question, it's not helpful. We all practice differently. We all live in different states, right? And we all have different perspective on how things should be done. But the reality is that this is a national test. So only information you have, it's what's provided. Do not add how, oh, this is how I did at my work, right? Because it may not be applicable and it may lead you to the wrong answer. So answer the questions objectively. Ask yourself, what is the core of the question? And match it to the correct answer. Do not look at the answer. Please do not look at the answers. When you look at the answers, every question almost will have the best answer, typical nurse question, and a possible correct answer, right? And two that probably has nothing to do with the question or doesn't really relate to the right answer. Between the correct answer and the second best option, you could get confused by choosing one or the other. So, one way to prevent that is asking yourself, take the fluff out. What is the core of the question? What is the question really asking me? If you can put that in one sentence and answer that, okay, if the question is about hypothyroidism, immediately you think, okay, what are the labs related to hypothyroidism? What are the symptoms? Okay, what is the core of the question? Asking how one would feel. Then you describe how one would feel if they have hypothyroidism. And then now you match what you said to the answers. And I promise you, this is an exercise. You won't get good right away. But if you do that, you know your content. I promise you that. It may be hard to even say it. It may be hard to really acknowledge that, but think about how much you have done, right? You know your content by now. So the matter now is picking the right choice. Okay. So ask yourself, what is the core of the question, and answer every question without looking at the answer. Then go through A, B, C, and D. Okay. So if you do that, it's likely to lead you to the right answer, and is the one that you mentioned. Okay. Every once in a while, the one that you mentioned is not that, you know, is not one of the options. In that case, analyze each answer choices and make your best um, decision there. Okay. So then you are going to analyze the choices, as I mentioned. So you want to review and narrow down to two most likely correct answer every time. Every time, whether you know the answer or you don't know the answers, you narrow down to two possible correct answers. On your test, you have ability to highlight, strike through the answers, mark down. You have, don't worry about it, how to do it, because you have all the instructions and it's super easy. Okay, super easy. So you cross it out and highlight. If you do not know the answer, do not spend more than a minute and 20 seconds per question. What do? You save the question and move on. All right, you moved on. Now you are on the next question. Do not be thinking about the previous question. Focus on this question. It could be that the previous question, the reason why you don't know is because it's a new question, because it's something new that they added. And likely, if you didn't know the answer, most of your colleagues will not know the answers and the questions will be thrown out. So why you worry about it? Don't. Strike through, highlight, save the question, move on. Now is a new question. Focus on a new question. You have to fight for every possible question, but do not get stuck on a question for 3, 4 minutes thinking about it, because this will lead you to less time for other questions that you know the answers, or you might know the answers. Okay, very important. Fight for each question. Disregard partially correct answers, as they are not complete solution. Oftentimes you have a sentence and another sentence and they are connected, right, by and, but, or whatever might be the connection. Ensure that the two sentences are correct. Oftentimes the first sentence will be correct and the second part of the sentence will be incorrect, right? So in order for this whole choice to be correct, A, B, C, or D, the whole sentence needs to be correct. So be careful. That comes to be very handy on the dopamine pathway. Very handy on TSH levels because it's so many of them. So what we do, hey, we put the correct answer first, followed by and, a connection, and then we make the second sentence incorrect. And then we place that on answer A or B because it catches your eyes and boom, it's a trap. It's a trap. Okay. So you want to explain the question, examine the question stem, and choose an answer that contains similar words on terms. Sometimes you read the question and then you see similar wording on the answers. Okay. And then again, if you don't know the answers, right? Pick the answer that always prioritize patient-centered care, not the family. One typical example, let's say the family is very burnout with someone that a patient that it has Alzheimer's, right? And the answer validates that, says, hey, the patient, the family is super burnout, uh, can't handle the patient anymore because the patient is always open the door at 2 in the morning, going outside. The family is super tired. Well, yeah, it's true, but it does not beat an answer that says arrange for possible long stay care for the patient due to safety reasons, right? So the answer that prioritize the patient is the answer, not the answer that prioritize the family, right? Even though both scenarios are probably true, but patient-centered care, okay? If several answer choices are almost identical, they may all be incorrect, okay? So oftentimes, oftentimes, if you have answers that are very close related, they both are incorrect. Okay. You know that anything that's absolute, what's absolute in life? Nothing really. So anything that says all, always, every time, never, uh, it's likely to be incorrect
Mike,
answers. Things that says, hey, all Native Americans are uh, at highest risk for suicide. I mean, suicidality, right? All, right? Instead of saying Native Americans are at the highest risk for suicidality. But if you say all, makes the answer incorrect. Okay. Generally, a medical evaluation answer is incorrect. However, you want to refer to a specialist if it's needed, particularly OB and PEDS case, right? Like Reddit, you are not going to treat it. You could identify and provide a diagnosis, but you're not going to treat it. So in that case, you want to send to a specialist, right? OB. Any questions that has OB, you want to look for things like collaboration, increasing mental health service, right? To those that are in need, collaboration. Anytime you hear collaboration, it should ring a bell, right? You don't work alone. Alone, we can do nothing, right? We need our team and our support, especially in the clinics, in the hospital. So anytime you hear collaboration, there is a buzzword that you should be uh, notating for possible answers. Okay. All right. So if you look at prioritizing, right, and judgment, so questions containing things like priority, initial action, what you should do first, right? It really determines the critical actions that you need to take first. So, what do you do? Three processes. One, which is the most important, but least likely to be in your, you will get some questions on number one, which is A, B, and C, airway, breathing, circulation. Well, this is a psych test. Yeah, sure it is. But there won't be a patient there if they can't breathe, if it's circulation, there is no blood. So, yeah, there won't be one. So every question you should look, is it about A, B, and C, airway, breathing, circulation? Most of the time is no, unless if, let's say a scenario here. Someone comes to the AD and she cut her wrist in attempt to end her life. Which of the following option would you be most likely or would be your priority at this moment? Assess the patient for current suicidal behaviors, plan, plans, or the motive behind her suicide attempt, right? That seems a very, very reasonable option. However, option B says take her vital signs. Which one would be the best option? A or B? Put it in the chat there. Let's see what you guys think about this question. D, right? All right. So vitals, right? Well, the questions about psych and like it seems like assessing for safety would be the most important, right? Obviously, airway, breathing, circulation is the most important in this question. But most of the time, it will not be the answer because most of the time, this is not a BLS class. This is not a CLS, right? Is not PALS. So questions most likely won't be applicable. But if it does, that is the most likely answer. Another thing about vitals, vitals is a collection of numbers that you need to make your diagnosis. In that sentence is no longer an intervention. It is an assessment. Okay? Anything that has numbers or that you need to collect to make a diagnosis So therefore, after that, you make your intervention. In your role is no longer an intervention, it is an assessment so you can make the diagnosis. Okay, so that's two reasons why vitals would be the correct answers. So second, if it's not about airway, breathing, circulation, then is it about Maslow's hierarchy of needs? When they look at Maslow, you think of a pyramid. And the bottom of the pyramid is food, water, shelter, air, things along those lines, right? Let me see if I can pull up a Maslow here. All right. So that way we can see this real quick and be able to also um, look at this real quick. All right. So let me stop this one, stop presenting, and just get you to the Maslow because the Maslow is important. So it's the second most important things that you need to understand anytime it says priority, first action, what you should do first. Airway, breathing, circulation. If the question doesn't apply, then Maslow. So if you look at Maslow, physiological needs, right? Water, air, shelter, food, sleep, clothing, reproduction, right? So that is your physiological need, things that will need to survive or, you know, have a community, have a country, or so forth. So if it's not that, it could be about safety, personal security, employment, resource, health, properties. And if it's not that, it could be about love and belonging. Well, anyways, so the core of the question, if it's not about airway, breathing, circulate, is it about Maslow's? All right. If it is, then you pick the answer that's about Maslow's. Now, before we move out of Maslow, look at what is on the top of the pyramid, self-actualization. Which core principle says only humans can self-actualization or self-growth? Who says that? Anybody remembers?
Rogers, Carl
Yeah,
Rogers.
Carl Rogers. Yes, Rogers. So yeah, Carl Rogers. Absolutely, right? So that's important that will come probably in hand during today's event later. But I just want to give you a glimpse of the peak of the pyramid. And that's where you are today. You are only here because all your needs below that, most of us, have been taken care of, at least physiological needs and safety. Self-esteem and love and belonging, those can fluctuate a little, but at the bottom of the pyramid, we need to have safety, right? We wouldn't be thinking about the board if my wings are being shot with bullets right now, right? I would have been thinking about the board if I'm super hungry and I don't have water or food, right? But self-actualization is the top of the pyramid, and that's where you are today, right? You have done all these other things, and this is an exciting moment. This is not a moment for panicking. This is the moment that you asked to be. You said one day I want to be a psychiatric nurse practitioner, and boy, you are so close right now. You can see it, you can smell it, you can see what's coming for your future, right? So this should be exciting. It's almost like my wedding day. I take that serious because I was excited, right? And taking the board is like, yes, 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 yes. Like my confidence is through the roof, right? And this is how we want you to feel. This is the moment that your life will change almost forever. Okay. All right, back to prioritize airway, breathing, circulation. If the answer is no, is it about Maslow hierarchy of needs? If the answer is no, then the third is the nursing process. Okay, and we said this is about priority, initial action. All right, so here is where we are different than RNs. Okay, if we say take vitals, we would say this is an intervention. Well, as a provider, all relevant, all important data is part of your assessment. You need those numbers to make a diagnosis. You need those numbers to assess, right? So it's all part of your assessment. So initial action, answers that says take vitals. Not only is important because they will bring the circulation, but it's also nursing process assessment. You collect the vitals to make a diagnosis, right? To assess the patient. Literature search. Well, you look at what's in there in order to assess your patient and make a diagnosis. Labs, collecting labs. It is initial action, right? Because an assessment that would describe and help you formulate an assessment and the diagnose for your patient. So these could seem like an intervention or an action, but it for us is part of your assessment. Okay, so assessment first, diagnosis, and intervention. All right, so emphasis on patient safety seems silly, right? But you will see so many questions that could be tricky. Always, when things are easy, concept, the test makers will find a way to make it hard, but they will not catch you. Okay? Patient safety must always be the primary concern. For instance, when someone has been raped, right? The immediate and appropriate action is to prioritize the patient's safety. So it would not be a let's let's make sure we do a rape kit to ensure that we can eventually uh, turn this to the police so that they can put this person in jail, right? That would not be the answer, right? The answer would be something like, do you have a place to go home today? Who are your support system that you can count on? These would be the answers because you analyze, hey, you have been raped and you have your airway, breathing circulation. This is not about Maslow. So this is about nursing process. And in this case, you're assessing the patient for safety. Okay. So things like that will come in handy in the next few hours when we practice in questions. So in patient settings, ensure the patient inpatient setting, make sure the patient is secure before discharge without relying on safety contracts. Safety contracts, never. Hey, I said never is the answer. Safety planning, it's a very high yield answer. Safety contract has been banned by ANA, right? They say no one should be using safety contracts, right? Because it's outdated terminology and really doesn't work. So it could be a high, it would be a trap if you see safety contract. Now, safety planning is high yield possible answer. Okay, safety contracts are always the incorrect answer. When conducting an interview in a semi-private settings, you want to prioritize safety above privacy. So let's say, for example, you are conducting an interview with a patient that has been reported to you that he has been violent, agitated overnight. But you still need to conduct your interview with the patient, right? Come up with your formulation, diagnosis, and so forth. So what do you do? Do you conduct the patient A at the cafeteria, or where they have the meals on open space? Probably not the best answer. Do you conduct the interview by allowing the patient's privacy to be protected by closing the door? That is not a good answer. That is about your safety. It's about the patient's safety. So, what would you do with an open door, allowing yourself a place to escape and the patient a place to leave the room, right? So, in that case, you are doing the best of what you can with the situation, right? So it's over privacy, right? Privacy, it is important when we can allow for privacy, but ultimately it's about safety, right? All right, child abuse. We see many questions out there, and some of them are so incorrect that it hurts me, right? So when you see child abuse, it is not a direct call to CPS immediately? No, no. You are masters prepared. You are doctors prepared. Your job is to interview the patient. Now, if the answer choices are not there to interview the patient, then the only reasonable choice is to call CPS, then by all means do that. But every time you hear child abuse, ask yourself, is that something that I can do? Can I collect more information so that way I can make an informed decision and don't jump the gun? Okay. So oftentimes will be a choice, conduct a patient interview with the patient. Now comes the question, will will I allow the parents to be there? It's a minor, right? Well, and the answer is depends. Depends on what? Who committed the possible crime? Was it the parents? If that is the answer, then you conduct the interview separately. Now, let's say who committed the crime, touching, abusing, or any of those crimes against children was the neighbor. In that case, you conduct the interview with the parents. Okay? So, let's say a child playing sexually with a doll. Your action is to collect more information, then report to CPS, not an immediate report to CPS immediately. Yeah. All right. That's not how it usually goes. Usually collect more information and then report to CPS. And please disregards what you have seen on the internet on other Facebook pages. They are incorrect. I promise you this. Okay. I couldn't see. I can only see the
Hi,
beginning of your letters. If you please
is
ask your question.
hi, it's Amna Fazia. So yeah, my question is this. I had a question on the ANCC that said the kid was locked out of the house multiple times and went to the school. Should the school nurse call the CPS, or we shouldn't call the CPS? Something like that.
Yeah, it is very difficult to answer because it could be other answer choices there. Usually, wouldn't be a call immediately to CPS. What we would do is try to attempt to find out. The reasonable thing would be attempt to call the parents and find out more information, and then possibly call CPS if you can't find the solution, can't find information. So it's really hard to answer. If you had the full questions, I would be able to give you more details. But it's always collect more information. What else did the kids say? I've been locked out of the house for 12 hours, been locked out of the house for 30 minutes, 20 minutes. Is this something that they reported that they always do to me? A little bit more information would be helpful. Shirley, please ask your question.
Hello, good afternoon.
Hello.
Hi. In a question where a 15-year-old was sexually abused by one of the parents, came to the ER and tell you she was sexually assaulted by the parent the day before, and the choices were call CPS or call the police and have the parent arrested. What do you do in that case?
CPS.
Okay.
CPS. You know,
Okay.
I mean, CPS is going to action everything after that, right?
Okay.
So CPS is going to come and validate that,
Mm-hmm.
right?
Okay.
Now, if the same question had given you collect more structure in the interview with the patient alone,
Mm-hmm. Then that would have taken,
that would
that
have
would have
been the
been
best
priority.
option. Yes.
Yes.
Now, option B, collect an interview with the parents, that would be absolutely incorrect. Okay.
Okay.
So make sure that you know who committed the crime. So that way, because it's a minor, you shouldn't be having an interview with the minors alone unless if it's necessary, right? Or unless if agreed upon during the beginning of your interview and it's not a crisis situation.
Thank
All
you.
right. Absolutely. Good question though. So yeah, the CPS question, it is important, and we're going to cover some of these questions today. So when dealing with teenagers, how do you establish trust? Right? Trust is important. It's super important. No relationships can thrive without trust, right? Loyalty. So you want to ensure confidentiality unless safety is at risk. So what does it mean? Let's say you have a 14 years old that comes to you and says, yes, I smoke marijuana once in a while. Now you're like, oh my God, this is illegal. This is, you have your own bias. I have my own bias. And you go like, this is illegal in my state. The patients are dangerous. What if they could be shot? So here I am adding extra information that was never in the question, right? We don't do that. So the patient reports to you, he is smoking marijuana every once in a while, but he asked you, please don't tell my parents. They would hurt me. They would never talk to me again. They would take my allowance, whatever the case is, right? What do? Don't tell. Okay. Unless, let's do a similar scenario. Let's say you have a 14 years old boy. All right. And he reports to you that he is in a romance with a 29 years old female. Okay. All right. We're switching the roles here, right? Now, would that be reportable? Yes. Okay. So now it's about the patient safety, right? Now would be a reportable situation, right? Now, again, probably wouldn't say, I think 14, it's no state would allow that, but be mindful. Some states, 16 years old might be okay. Some states may not. Most of them are not for sure, which also applies to the Tarasov principles. In fact, in today's questions, we are going to talk about the Tarasov principles. And just for gigs, I put a bullet there, which states do not enforce the duty to warn or duty to protect, which often is related to the Tarasov principle. So when we answer our questions today, you will see 3 questions about the Tarasov principles, and they will absolutely drive you crazy, right? Because it's the same question with a small twist. So stay tuned, all right? And the answer will change completely, right? So confidentiality is how you build trust. If you break confidentiality, the patient is not coming back to you. All right. So who has a question there, if any? Okay. No questions. We'll keep on going. All right. So only break confidentiality when there's a safety concern. All right. Now, interview teenagers privately to maintain confidentiality. So when I have my interviews with my patients, mom and the kid usually, most of the time the dads don't come along. 99% is the mom. And I put all of them in my room. I go through my paperwork and they say, uh, let me be clear to everyone. I'm here for the patient, and our conversation is confidential unless is a safety risk. Mom, first I'll have a conversation with the patient for about 30 minutes, and when the time is done, she'll leave, and then I'll have a conversation with you for about 10 minutes, and then I'll bring both of you guys back in the room, and then we'll finalize the next interview and so forth, right? But I put this ahead of time, so that way the patient knows that she can disclose anything that she feels that could be helpful for her or for her treatment, but also know that she can trust me. I said that in front of the mom that I will not disclose information unless is a safety risk. And then there comes a problem. So what would that problem be? Right? The problem would be a who's paying the bill? Like, who am I loyal to? Right? So it becomes an ethical dilemma. If I'm referring to these things, it's likely that you will see on your board. It becomes an ethical dilemma. Do I serve the parents? Do I serve the 14 years old, 15 years old patient that I'm seeing, right? So you want to interview and maintain confidentiality when all possible, right? Where is the line? The line can be very blurry at times. Try not to be very rigid, be fluid. Ask yourself, is this a major safety concern? If it is yes, then the answer is to report. Okay? This action will create an ethical dilemma, as I mentioned, right? So, for example, if she or he is having sexual attraction to someone of the same sex and they are dating someone of close related age, that's not something for you to report to the parents. Okay? If someone says, hey, I have, another boy says, hey, I have sexual encounter with my classmate, he's a male, and that is not for you to report, right? The question didn't say the other person is using IV drugs and having unprotected sex, none of this, right? So don't add anything to the question. That's not reportable, that you should not disclose that to the parents, right? Keep the information confidential. Patient has the right to confidentiality, but not privacy. Well, we just went over this previously, right? Someone that is violent. Well, the right to confidentiality means you will not disclose this case with others. Privacy is keeping private. So patients have the right to confidentiality. We want to allow privacy, but it's not a must every time. For example, let's say you have to do a examination, which you probably would never do as a psychiatric nurse practitioner, uh, on someone's sexual organs. You can request someone else to be in the room for your own protection, right? You might not want to be like, I would not want to be in the room with the female alone and have to do some exams that may be interpreted differently, right? I wouldn't want to have somebody else in the room just for my own safety, right? For patient safety as well, right? So in that case, patient has the right to confidentiality, but not privacy. You want to allow privacy as many times as possible, but not when you are at risk or when the patient is at risk. Critical thinking, right? Understand the reasoning behind your answer choice. Is it really clear, right? Why are you asking for a HCG? Which, by the way, anytime you see HCG, it's high yield on a test because it's probably linked to a medication that could cause birth defect. If you're asking for folate and B12, what's the rationale behind it, right? If you are asking for a liver function test, is that drug metabolized by the liver? If you're asking for lithium, you would be asking for a kidney related labs, right? So just understand that, hey, why am I asking this, right? What am I going to do with that? Now, I mentioned earlier that anytime you see collaboration is high yield, right? Collaboration with your peers, collaboration with different department is high yield. Please go ahead and ask your question, Shirley, if you have one.
Yes, going back to the folate and the B12 you just mentioned,
Yep.
macrocytic, correct?
Yes, we're
Now,
going to have a question on that
Yeah,
as well.
let's say on the somewhere along the line, I was working on some questions and I noticed the macrocytic, and they ask you which tests will be the most important, B12 or folate, and they had both of them on there. And I was looking for B9, but I saw B12 and then folate separately.
Both of them. Both of
Yes.
them. Right?
Yes.
Both of them. It shouldn't be just one. Absolutely wrong. It should be both of them. In fact, it should be B9, folate, and iron. Iron has not to do with that, but you want iron to rule out other blood-related anemias,
Mhm.
right? But we'll have a question on that coming up, so that way
Yeah,
we can
because I
make
was
things.
looking for all three, but then they only had two. They had
Well, if they
folate
have
and B12, but not together.
correct.
They had the
Oh,
first
but
answer
not
A.
together.
Yeah,
Oh,
the first
yeah.
answer A was folate. Then B was a different test that had nothing to do with the macrocytic. And then C
Mm.
was B12. And then D was something else.
Oh, okay. And what was the final answer, if you remember?
I believe they said it was B12.
Yeah, I mean, I can go with that, but because yeah, I we can clarify that in a minute. But B12, I would hate that question. I would hate, and I think most uh correct. Someone says micro would be iron. Correct. Because that question is incongruent and this is confusing because you would never in your life, never ask only B12. Never. Right?
Right. Mhm.
So it would be like, it's probably a bad question. Anyways, it probably would never be in your test. Not specifically only B12, but sure it could be B12, B9. And if the same answer has iron, that would be better than just B12 and B9. But
Okay.
understanding the reason why you're adding iron to it, it's not because it's macro, but because you want to have a complete labs to make your diagnosis.
Okay.
All right. Thank you for the question. So collaborating with nurse manager, dietitians, and nurse supervisors is essential, right? Do not delegate to them. So let's see a question. Let's say you have ordered 2,000 calories per day for your patient that's taking a antipsychotics, right? So antipsychotics, they have the risk for metabolic syndrome, particularly second generation. So second generation is good. 5-HT2A is added to that. Now less EPS symptoms, but more getting a little bit extra weight, the metabolic syndrome. So you said, you know what? Patients only need to eat, this patient only needs to eat 2,000 calories, right? And now you notice that the patient is eating 4,000 calories, right? So what do, right? So you want to collaborate, preferably with the entire team. You do not want to go to the dietitian and say, why is this patient eating 4,000 calories a day, not 400, 4,000, 4,000 calories a day, when they order 2,000 calories. Well, the order is probably right. The patient's probably getting snacks from the nurse's stations or so forth for somewhere, right? So you want to get everyone on board and see what is the issue, right? Collaboration is the key. In cases where postpartum patients are at risk, they are at risk for suicidal thoughts and behaviors, you want to ensure that they have an assessment collaborating with OB, make sure that they have a PHQ-9, Edinburgh assessment done. So before they leave, so that way you can identify postpartum depression. That is high yields collaboration, right? So when do we have informed consent is obtained when the patient transferring information or making appropriate choice is to fax the patient's medical history to a receiving facility rather than asking the patient to hand carry, right? So when it comes to the medical charts, you want to be secured as possible. Can you email it? Yes. How? Needs to be a two-way encrypted. Cannot just be Gmail, Yahoo, right? Now, the preferred way is to faxing to the receiving facility rather than the patient hand carrying this information with them, right? So faxing is a great way to do that. So do not tell the patient, hey, just take it with you to your next outpatient clinic. So two forms of consent are needed. Two forms of consent are needed when you have a psychiatric condition plus alcohol, opioids, cocaine, marijuana, any SADS condition. Two. So you need one, consent for psychiatric condition, and one consent for SADS disorder, right? To release the information, you need two patient consents. So consider what can be done for the patient before making a referral, such as requesting a urine screen if the teenager has ingested acetone to rule out substance use disorder. All right. Very confusing question here. Okay. I have used acetone in the past. I was trying to get high. In that case, you want the next step, your priority is to get a urine drug test. If the patient says, hey, just before I came to your office, I was inhaling acetone, now I switch the question completely, right? Now it is a 13 years old, just finished inhaling acetone and says, I feel funny, right? And disclose that to you. You're at that point, right? You are concerned about respiratory depression. You are concerned about many other possible drugs. So at that point, you want to direct the patient to the AD. So this is a clear case how one question can be one answer, but can be another answer. All right. So if the patient says, hey, I just finished ingesting, or not ingesting, inhaling, or us ingesting would definitely be AD, it would be more of inhaling acetone, right? Then it's likely to be transferred to the AD. for medical stabilization. If they say have history of use and having used in a long time, then you want to look for urine drug screen to see what other possible drugs or is the patient using. Okay, just so you know that if someone inhaled acetone and you asking for a urine drug, it would not show up on your urine. Okay, it would not show up on your way. That's a specialized test. So therefore is also the wrong answer to just say, hey, let's get the test here for you, right? Because it wouldn't show up. All right. Cultural considerations, right? Cultural considerations, super. Please ask your question. I think there was two questions. That's so let's answer the question before I keep on going. Super. Please unmute yourself and ask
Dr.
your question.
Lopez, please,
Hi.
for this question with acetone. So when the patient comes to you and tells you that, so you call 911 to take the patient to the ED?
Oh no. So let's not make assumptions here. Okay. So it really depends on where you are
So if
and how's the
you're in
system
your
work.
office.
Yeah. Well, we're not assuming this, right? So you want to direct the patient to the ED. That would be the answer. How the patient's going to get there is not important for the test.
Oh.
Do you
So
see? Like the test, everything is perfect. Like ED is next door. It's not, you know, now if it specifically said the ED is 70 minutes away from here, you don't have a transport. If it give you the information, then you add it. But that is a perfect question because that would be the first thing that we would add to this question is how is the patient going to get to the ED? But it's not what the questions, the answer is telling you. Telling you is, direct the patient to the ED. That's what it's saying. It's not adding anything else. So very good question. Thank you for asking. Does it make sense?
I guess.
I guess so. Tell me what it doesn't so we can clarify.
Because I was thinking if the patient come to the office and tell you that I just ingest or you smell acetone, maybe you will have to collaborate, send the patient to the ED, thinking about safety reasons. But if the
Right.
answer say, okay, direct the patient, so which
Well,
means we think that.
collaborating or directing the patient to the ED in the sense as we're talking about the same things, just using slightly different terminology. So the final point is to the ED for safety
Okay.
reasons. All right. So thank you for asking that. So that was just a collaborating the patient to the with the ED doctor to provide an assessment and a complete log drug lab screening or to ensure for his safety or her safety. Right. That's all in the same realm. So what we're looking here is, do I do a drug screen which wouldn't show up, or do I send the patient to the ED? Okay.
So if
All
they
right.
come and you are just smelling it, you don't do drug screen, or do we do drug scan? Which one? Or do we still send them to ED?
Well, it really depends when it happened, right? If it says, hey, just 30 minutes ago, and I feel funny, right? You don't know what's coming next. So you want to ensure the patient's safety. At that point, ED would be the best option. If they say, hey, I just want to disclose to you, please don't tell my parents. But every once in a while, I inhale, hopefully it would be never ingested. I inhale acetone. And then you might want to do a drug screen because it's an active habit and there's no life threatening at this moment, right? And then age is super important, right? Because age, especially younger kids, they 7 years old and younger and so forth, 12, not 12 as much, but younger age, they respiratory depression is how they they get killed. It's not a heart attack, for example. All right. We'll go more on this question specifically in a little bit. So culture, right? I talk about this all the time, and hopefully by now you guys are very aware of culture. Culture is high yield, and it is a funny business as well, right? Because you went to school, you got all this knowledge, and you wanna be evidence-based practice scientifically. Most of us do, at least, right? And sometimes we don't take culture in full consideration. Sometimes, right? So when you are answering a question about culture, make sure is a culturally sensitive answer, never a scientific answer. For example, if the mother brings the child and says, in my country, in my tribe, in my region, whatever, I rob, we rob leaves on the skin. And yesterday, to prevent whatever evil eye, let's say that's the case. And now today, the child comes to your office, you look at the arms, it looks swollen, you take the vitals, he definitely has a fever, right? So what would be the action that most of us would do? We would collect labs to make sure it's not systemic. We would look at few other things, but the answer would be something. Please help me understand this practice. That you do. Please educate me, or tell me more about it. Right? So how do we know it's a culture question? Well, if the question goes out of the way to say he's a male, 45 years old from Puerto Rico and speaks Spanish, or if it says from another country and it gives a little bit more of what they do there, that is a cultural question. Okay? It does not cultural influences. So do not equate culture influences response to mental illness, right? Some things that they do in different cultures, it is typical to the culture. It is not a mental illness. Okay, even if it's very different than what I do or what you do, right? Clarifying the meaning of the illness and they kind of try to seek understanding the cultural context of the patient, illness, or challenges. So that way you're not having your own bias, but you are supporting the patient fully, right? You want to contextualize their situations in their own world. What does it feel like to be in your culture? What does that mean? Evil eyes or mal de ojo, right? What is that? Please educate me. Help me understand so I can better serve you. Okay, so you want to empower the patient by understanding their perspective and validating the symptoms. If the mother says, hey, he has evil eye and this is the reason why he's vomiting, having diarrhea, so your answer is not to collect labs, not to give an IV for hydration. All that is important, but your answer is to validate what the mother is saying. Good example. Let's say you have well uh a Indian American, let's put it that way, or Native American that believes that comes for an admission to the inpatient. He holds his healing stick every day because it protects him. Okay, but then you are in this predicament. Is the inpatient, and this guy has a stick on his hand, and he wants to be admitted because he is super depressed. but he does not want to give the healing stick out. What do? Do you admit the patient with the stick? Do you explain calmly that this is against the hospital policy? Or do you ask for a meeting with the staff for further evaluation of the situation? What would be the correct answer? A, B, or C? What do you guys think? A, admit the patient with with the stick. B, it says no, it's against the policy, we can't do that. Or C, conduct a collaboration with the nursing team to see if it would be possible, something like that, right? So
C.
as weird as it sounds, oh, somebody said C, right? Somebody said C. Great. I'm glad that you said C. C is the incorrect answer. Okay. Why is C the incorrect answer? Because it's a cultural question. And cultural question says because he's Native American and he believes this will protect him. That's what the patient told you, right? Then you open a exception to the patient. Now let's not add stuff that's not in a question, but he has a stick. He can use the sticks to hit somebody upside the head, right? Or somebody else can get that stick and puncture someone, right? This is not in the question. Okay, so that is a perfect example. While maybe C sounded really good because I said collaboration with the nursing, but it didn't say to make an exception, or maybe it wasn't well formulated C, right? But sure, maybe the best answer would collaborate with the nursing staff to ensure safety of the patient, but open an exception to this specific patient, right? Because for the admission process, you want to admit the patient because the patient is super depressed, needs to be admitted, accepts to be voluntarily admitted. However, he wants to hold his healing stick. Do it is a cultural question, right? In practice, in your hospital, follow the hospital policy, move it up in a chain of command, take that outside of your hands. Once they make the decision, pick up the decision, bring it back to the patient, right? That's usually how things would be done. Because that would be possible safety concern. But remember, past is a bit different than real life. And I'm not saying that they shouldn't open an exception in real life. All I'm saying is it needs to be a lot more complex than just admit or not admit, or accept or reject. But in the task, it might be just, hey, if it's testing about cultural considerations, apply and give a culturally sensitive answer. Okay, so your job is to validate the patient by asking more questions and acknowledge the patient's pain levels of their own perspective of what is happening, right? It's not so much to say, hey, I went to school for 7 years and now I have all this knowledge and I know this is an infection and we need labs. So that would not be the correct answer. So guys, I am huge on breaks, and it's not for my own good, it's for you guys on benefit, because I could go on for hours and hours and hours without a break. But take 9 minutes break. Let's be back at 6:20, and then we're going to start the questions right away. All right, so take a walk, go to the bathroom, get a cup of coffee or water. I'll see you in just few minutes. Okay. All right, please send me an email